So this is the MEMSAM study, which is the multinational survey of the aging male. And you'll see here that disappointingly, as men get older, their erectile function score deteriorates. But if they have lower urinary tract symptoms, then look at that. The men with the most severe lower urinary tract symptoms have the worst erections. And that's because of the links between LUTS and erectile dysfunction. That's what I call the LUTS effect on erectile function, deteriorates. So what I've tried to tell you is that if you can't get an erection, then your heart is headed in the wrong direction. But also, so is the bladder. And actually, we can prescribe PD5 inhibitors to help both LUTS and ED, and we get treatment for two conditions with one drug, as I'll tell you. So what is ED? Well, it's the inability to initiate and maintain a penile erection sufficient for satisfactory sexual intercourse. And if a man has ED, it's a disaster. And this is not new news. Leo Tolstoy had sussed this out. He said, "Man survives earthquakes, experiences the horrors of illness and all of the tortures of the soul. But the most tormenting tragedy of all time is, and will be, the tragedy of the bedroom." Erectile dysfunction. And it's a huge problem. So as a primary care physician, you need to know how to manage this condition. Because if we look at the scope of the problem, we've got 152 million people in 1995 expected to rise and double, in fact, to 322 million men by 2025. That doesn't mean they all have to chip up at your surgery, but the men are out there and they will come and talk to you about it. And in fact, it's terribly common because this is the Massachusetts male aging study looking at men between the age of 40 and 70, and only 48% have normal erections. More than half had erectile dysfunction, either complete, moderate, or minimal. So it's a big problem. And actually, if you see patients with comorbidities, then it's important to ask about ED, because here you see that about 26% of men with high blood pressure will have ED. A third, if they've got heart trouble or angina, 26% with high cholesterol, 40% with diabetes, and about a quarter with anxiety. And that was a 2004 study. In fact, there's research to show that actually it's much more common than that. Seek and you will find. So I guess the reason you've logged in tonight is because you want to know how to deal with it. So what did the men do to try and help themselves before they came to you? Well, some of them talked to their partner, about 40%. Only 18% had talked to a doctor. So I think that fits very nicely with my 80-20 score, doesn't it? Some have looked in books, some have looked on the internet, some have talked to families and friends. But there's a large number of men which are not really helping themselves, are they? So at the end of the day, there are two approaches. You can wait for the men to turn up and react when they do. Probably not very effective, and it rather suggests that more than half of men, perhaps even up to 80% of men who have ED, probably don't get treatment from their GP but end up going onto the internet and buying Viagra on the web, which is dangerous. But perhaps in primary care we should be proactive because of the links with other diseases and the opportunity to manage cardiovascular risk and diabetes better. So once you raise the subject, is sexual function something you'd like to talk about it, you need to ask the right questions to try and get an understanding of what exactly is going on. How is desire? Can you get and maintain an erection? How hard is it? Is it consistent? Can you penetrate? Is it a bit wobbly, which makes penetration difficult? Can you orgasm all right? Ejaculate all right? How quickly do you ejaculate? What about your partner? Does she have postmenopausal vaginal dryness? Do you know about lubrication, and should she be on topical estrogen? Can you sustain your erection long enough to satisfy your partner? And when did you last have sexual intercourse? All important questions which will give you a greater understanding of what is going on in that particular patient.